nice and fun.
First off, I want to say, everybody, love all the people in this room. I appreciate getting another episode down with you.
Absolutely.
Big Mike, I appreciate you coming in and doing your damn thing on a daily basis. You motivate the hell out of me. Every morning, when I was training in the morning, every single morning that I go there, 7 a.m., he's busting it down. Walking lunges, weighted carries.
So I appreciate you guys for having me on. Like I said, it just, definitely interesting to do. Not only talking about myself, but I've used to doing podcasts and talking about more specific things than injuries and things like that. But this is fun.
Yeah.
So thanks for having me on.
No,
guys.
it's good. It's good conversation.
Yeah.
It's good stuff. Like I kind of just said in the intro a little bit. You're somebody that a lot of the people at our gym, Bev Francis Powerhouse, which every single time we do an episode, it's like the Bev's crew. Everybody, we all know each other through Bev's. It's just it's a very warm group. So when we all cheer for each other. So when we see people from the group doing well, we all get excited. And you've been doing well for a long time and helping athletes. That's the biggest thing.
Right. Doing what I love.
Because if you were bad at your job, you wouldn't be doing well. So you're very good at your job, which is amazing.
Right. And like you guys are demonstrating right now, you have passion.
Yeah.
And I think that's the key component of anything successful, is keep doing your passion.
So now let me ask you, I have to ask the base question just to kind of get it started. What got you into the space of working with athletes? Like, did you have a passion for that when you were younger? Like, how did we start off with that?
Yeah, I mean, it can go like how many directions you want to go. Without getting too personal, but basically for the educational component, I went to University of Maryland. I studied kinesiology, exercise science, and I was going to be an athletic trainer. You're familiar with athletic trainers work with sports. And then I had an interesting conversation with a doctor who kind of was talking down to me about how to rehab an athlete, and the doctor himself was like 6'2", 500 pounds, and I was like, okay, when was the last time you actually lifted a weight, and telling someone what to do with the weight? So I kind of got a chip on my shoulder. I decided I was going to take the MCATs, which is the admission exam for medical school. I did very well. I got into a few programs. I chose to become the osteopathic route, which is more of a manual kind of approach with medicine, in addition to using like drugs and surgery techniques. So I did 2 years of that. I didn't really like the medicine component of the DO school programming. And then I realized, I like to become a physical therapist, but I was going to use the manual medicine component of my training, and that's what I did. So I went back, got my doctorate in PT, continued to use the osteopathic manual approach, which people think is like chiropractic, but actually chiropractic came from the osteopathic medicine background. And then combine that with my strength and conditioning background with training athletes, and then I kind of had a niche in the market that no one was doing. Traditional PT was you come in as a hot pack on your body, some stim, some stretching, some ultrasound, and I never did any of that shit. It was basically like, you had Dr. Kasher on, phenomenal guy who actually I learned active release as well. Yeah. And in the beginning, like he had a niche on the market working with athletes because he's a big guy, had something in common with these athletes to get them through an injury because he could relate to being hurt. And you just use a different approach working with athletes, and that kind of spreads your name out. So that's how I eventually got into becoming, a PT working with athletes.
You have more of that Tom Brady chip on your shoulder.
Yeah, I did.
Let me get every certification I can get.
I did, and I still continue to do that now as well. Never stop learning. But it was just an interesting approach. Like people ask me about was I an athlete, things like that. Again, I don't know where you want me to go off, but again, my dad was a Marine. He's an amphibious recon Marine. He told me how to train when I was a young age. He told me to box. But my parents are good people, but they never really supported me with my sports. Not a bad thing. It was just a different generation of time, And like I was a good wrestler, but I wasn't having parents at my matches like cheering me on like I'm doing with my kids, or playing baseball, someone going, oh, you got to go practice and hit the ball. You got to have a catch. So my dad was busy. He was an assault cop after becoming a Marine. So it was like they were good people, but just working. But I didn't have that constant encouragement. It was like,
what did he kind of want you to do instead?
Nothing. I think because my dad was very poor growing up. He was one of 7 kids. And his dad was very tough on him. He had a very bad upbringing. And I guess my parents were, especially my dad, didn't want to be that parent like pushing me to do something if I didn't want to do it. But they should have asked.
Yeah.
Like I wanted to become a Marine. I saw my dad, I got the application to become a Marine. And he almost flipped out on me. He's like, what are you doing? You're going to go to college. You're going to get an education. And then I was in college and I took the Suffolk County Police test. And I was going to become a cop like my dad. And I got 100 on the test. And I came home from Maryland. And he's like, what are you doing home? I'm like, I called for my physical and become a cop. And he's like, no, you're not. You're going to get your ass back to school and you're going to get an education. He's like, you're better than that. And I was like, okay. So I think everything that I saw him doing, I want to do. But from his upbringing was so bad and tough, he saw for me a different route. Gotcha. And just kind of said, just focus on your education, and just do your best you can.
Yeah.
So, and that's kind of what I did. I mean, I wish I could have done more with sports, but, I walked on the Maryland's wrestling team, but it was a different level. I couldn't really compete. I'm physically strong, but just the skill level at a Division I program was intense. you know, I've always liked boxing since the age of 8. I wanted to compete in that. I was actually pretty good as a boxer. My dad, again, talked me out of it. You don't want to do that. You want to go get an education. I was like, okay. So, you know, so with that, what I've turned with my own kids is like I support them, but I don't push them. But I do
Which I see, which is awesome.
Yeah.
I mean, listen,
Yeah.
when we were originally supposed to get together a couple weeks ago, and you had said, I don't miss my daughter's softball game.
right.
I couldn't respect that more, especially as a younger guy where I wanted my dad to be a little bit more involved with my sports that I was doing. I mean, I was like, please, take any time you need. We'll reschedule around you. So
Right, I appreciate that.
Oh, come on. I respect
Absolutely.
the hell out of that. That's A1 dad right there. So I
thanks.
love that you're involved and you have the background to not only help her, and you're both, you know, you have multiple kids.
Yeah, two daughters.
Yeah, two
Almost
daughters
call
to
me
help
out.
them to help them get better at their sport, but to keep them injury free for the most part.
Hopefully, right.
Yeah.
And then, like I said, for the first 10 years of my practice, kind of brings me where I'm at now, was when I started, I really was just working 80 hours a week, dedicated my practices. Someone called me from the gym on a Sunday afternoon. I was there working on them and treating them. If someone needed me on like a Monday night at 10 o'clock at night, I would go in and see someone. And then I just dedicated the first 10, 12 years of my practice to building my name, building my passion. And then I said when my daughters hit 12, 13 years old, I was going to take a step back a little bit and make sure that I'm there for their sports and encouragement and supporting them. Not living through them vicariously, because that's not me, but just making sure that if they want to do things at the next level, this is what's can't breathe with the smoke. Sorry, because of like, you know, making sure that they put in the time and the work ethic that's needed to achieve to maybe become a D1 athlete or move further onto professional ranks if that's what your goals ought to be.
So did you start this path with your own practice, or did you work in an office and then go into your own?
Yeah, so I graduated from New York Institute of Technology. I was the first class of a doctorate program. I had some connections in Tampa, Florida. During an undergrad, I was always traveling around the country, trying to seek out the best strength coaches in the world. At the time, you had Terry Todd, who just passed away, Juan Carlos Santana, some other guys, Mark Verstegen. I don't know if you know the guys. These are the original guys.
I heard the first two names.
Yeah.
I don't know the last one.
These are the guys who created the functional training methods, and Gray Cook, which is a legend in the field of physical therapy. So during my breaks from college, I would actually kind of reach out to these people, and you could do through email, get in touch with them, no problem, and then say, can I spend a week or two with you, kind of shadowing, enhancing my own skills. I'll shut my mouth, just listen like you're supposed to do. And I did. I would travel down to Florida, travel down to Texas, and kind of just find the best named at the time back in 96, 97, who was a legend in the field of strength conditioning or powerlifting, and just go there, listen to them, learn, and then come back and start to apply my own ideologies and kind of build my base of what I was thinking about doing in the next level.
Mashing it all together.
Yeah,
Almost becoming like
exactly.
the Frankenstein of everyone's.
Yeah, that was always my
Which is
goal.
great.
Yeah, you know, like certain parameters of like strength training were just one way. You know, bodybuilders train a certain way, but then I really do believe I was one of the first people combining, you know, strongman training and powerlifting training with the bodybuilding concepts. You know, kind of meshing it together, which no one was doing at the time, and Kevin English can attest to that. So I was just always kind of seeking knowledge. I still seek knowledge, but that was kind of the thing what I would do during undergrad, and then coming back and kind of building my philosophy.
That's one of the biggest problems in this world, though, is everybody just finds one path, says, I want to be exactly like this guy, and they'll do Arnold Schwarzenegger's program forever. They'll say, I like how Nick trains. I'm going to do that forever. But when you go and really observe all these different techniques to just sit there and make your own,
Right.
you got to see what works best for you.
Exactly, because we're all genetically different. There's similarities, but
Exactly. I'm a bootleg Meadows workout. That's all I am.
So-
that's 99% of what I
John
do.
Meadows,
so.
awesome guy. He actually, I think him and I probably share a lot of common philosophies about training, because I watch his videos, I follow him on Instagram, and like these are things that I believe in incorporating as well. He uses bands, he uses chains, half rep methods, things like anything that's combining to make sure that we're applying a greater stimulus to the muscle tissue. He's incorporating, not just thinking like you said in one dimension, like a bodybuilder like Arnold, and training that way.
I just started cluster sets on the new program that he has.
They're tough. How
So,
long of a rest you take in between your sets?
Yeah,
30
yeah.
seconds.
I think it was a set of what we do last night. We did back, and we had we were doing dumbbell rows. I
Okay.
think we stopped off at like the 130s. We were
Okay.
doing them for 8 reps.
Okay.
Dropping it for 20 seconds.
There you
Then we
go.
came back, did it for 6 reps. Dropped
Yep.
it for another 20, and then we came back and did it after another 20 seconds. We did it for 4 reps.
Right.
So I mean, but it just it
They're
feels,
challenging.
Oh my god, it
Yeah.
feels like or he does dead stop rows.
Okay.
Dead stop rows always get me because it feels like the first rep
So
every
is
single
he
one.
pausing at the bottom of the position?
Bottom. So you row it up, put it back on the ground.
Yeah.
Rowing it up.
But
put
it's
it
good
back
because
down.
a lot of times you can't get that contraction. So by coming to a complete stop, re-engaging the muscle in an appropriate way, and then pulling it back up, you can re-engage it correctly and get a better contraction out of the muscle.
Yeah,
So-
it's wild.
Yeah.
And I know you know your stuff. I did one of your workouts with Gabe a while back. That was great.
Gabe's awesome.
Yeah, Gabe's great. He's always
Yeah.
He's always broken. Nobody could fix it. It's wild.
yeah.
It's wild.
He trains hard. So
Yeah.
he's just very, he's
Yeah,
just-
but I mean, from day one, he's always sworn by you, your
Yeah,
methods, and everything like that. And I know that if he uses anybody else, he doesn't feel right. So like he comes to you and
I love having him.
Yeah, you
Good,
tune
good,
him
yeah,
up and
yeah,
he starts feeling better, and then he's in the gym and he's like, I gotta go see Mike again.
Yeah, he texted me earlier. He's like, got any openings before I go away?
Yeah,
And I'm like,
exactly.
He does that cluster set. He's like, Mike.
Mike, please. Oh my God.
But
I
with,
can't do it.
But with that, with injuries, you got to get confident too. I mean, we're all been hurt. We kind of get over it. And like, it's not going to kill you to kind of keep doing things. So you just got to find the way to work through it different ways.
Yeah.
So-
So now let me ask you this. So
Shoot.
you open up your practice, and this is in what year? What year did you open up?
So back to that. So I started my career in Florida, so I get sidetracked. But
No,
I,
we all do. It's okay.
Yeah.
We kind of trail off, and then we come back
so
to the main
one of my
story.
first mentors was working with Major League Baseball in the NFL. He had a big clinic in Tampa. So he recruited me out of school. Mona and I, we moved down to Tampa, and I had this great opportunity to learn from, his name was Hap, and my other friend Jason was, and it was basically just getting, entrenched with Major League Baseball, NFL players, the Tampa Bay Lightning for hockey. I mean, I don't know any of these guys' names because I wasn't a big hockey fan, and I followed a little baseball, but I'm a Yankee fan. And just learned how to rehab a Major League Baseball player, how to rehab an NHL player, and really now incorporating my ideas with strength and conditioning, which they didn't have the background because they were just basic PTs, great PTs, but not, again, being under a 600-pound barbell back squat or deadlifting 500 pounds or causing your eyeballs to bleed and bleed out of your nose when you're doing a heavy squat. So, being in the trenches, training hard, something they never used to, but I can now take an athlete, say, like I had the experience of mentoring under my friend Hap, who trained Mike Olstad, famous Buccaneer fullback, who was a beast of a man, came back from neck surgery. And again, we're training him, but now I can step in and say, oh, you want to do some farmer's walk or you want to get back to deadlifting. So I had the experience now to kind of transition him from, basic PT rehab to the next level of training that he needed to get back to and play another 2 seasons on the field.
Which is tough because all these sports have different taxing reasons
now
on,
they're
on,
doing
on
it
people's bodies.
Right. Now everyone's kind of getting back after the surgery, whether they're successful or not. But at least they're having the ability to say, I can train, make one more attempt at a comeback and see what I can do, and then retire if I don't have success.
Which sport would you say? I mean, you automatically think football, but sometimes like hockey's a rough sport too, and baseball has its own
Fighting.
internal. Fighting is the one.
Fighting is really I think the most brutal sport, especially MMA. I'm not a big fan, even though I probably was one of the biggest names, completing training with MMA fighters in UFC coming back up here to Long Island. But these guys get kneed in the face. They get orbital bones that are broken. They break their hands. They have multiple injuries through their neck. I mean, the extent of injuries they go through, and then to actually compete at 100% is never going to happen. These guys step in the octagon probably at maybe 75 to 80%.
Because of all the years that they've done
abuse,
prior.
and it's such a small window of opportunities to succeed. I mean, if you're in your 20s, that's the prime area, and then once you get to 28, 29, they're kind of like, they're almost done.
Yeah, body starts breaking down more and more.
They've been through so many extensive fights and getting hit in the head, concussions. I mean, we can go on and on naming injuries, but it's like, fighting is definitely really brutal. At least with hockey, the boards, and you look at biomechanical studies, they're actually giving. So you get checked into a board, you think it's getting hit hard, but the boards are meant to be giving, so the actual body cannot absorb all that force. So that goes into the boards.
Gotcha.
So the trauma is less.
So so it travels through a little bit
Yeah,
more.
I mean, still getting hurt. Don't take anything from any sport. Soccer is bad too. These girls go for to head a ball and they plow heads and they
Or
concuss.
I've seen the cleats to the face.
Yeah, exactly.
Going for
So-
a high kick and someone's heading it and they just like connect the wrong way.
So for me, I think definitely dealing with fighting athletes is probably the worst.
So on that actually, because it's pretty interesting. So when you have somebody that has all these injuries, and obviously it's a slow and steady bring them out of it. But a lot of these guys, they already have next fight in mind, right?
Yeah.
So they already have their mindset on, I lost this fight or something. I got to get back in eight months and I got another fight to get to.
Right.
Does that kind of put more pressure on you to help? I mean, because obviously there's only so much you can rehab before the body starts healing.
I never felt pressure in my career. People come in and you have big names in front of you. It's basically you have to be able to learn to talk with them and not at them. And I think a lot of times these athletes are so successful that they're around people who just kind of yes them.
Yeah.
And I really don't care if you have like Tom Brady in my office or someone who is a lesser scale or someone like me and myself going in there working an average person. I'm going to teach you the same things I'm going to teach an average person to a professional. So I think if you just kind of lay the law down with them, you build confidence with them and say, look, this is the injury that occurred. This is the trauma that you've been through, and this is the complications that can occur later on if you go and can compete again. I mean, if you look at Weidman, for example, he's had neck surgeries 2 times,
That
hand,
leg
elbow,
one
and
was-
now he just broke his leg. And you actually talk to him, he's actually thinking about returning, coming back.
Really?
Yeah, it's crazy. But
I've talked to a few fighters that I'm friends with, and they said usually guys that right after that type of an injury, it's a hard comeback, really hard.
yeah, I mean, he's down in South Carolina. He just started rehab. You see on Instagram. So we talk to him every week. But he's definitely focusing on trying to get a comeback fight. So you support him and you do everything you can if he chooses to come back up to New York and to kind of do some rehab with myself and John, and that's my colleague. But you just kind of support him, and then eventually let the doctors kind of make the decision and say you can go here or you can't go here because of your injury. But they do it. They come back. I mean, Silva came back from the same injury and he fought again.
Did he? How many fights did he do after that?
Maybe two more after he came back.
Did you see that injury?
No, I didn't see it.
Oh man.
So yeah, definitely.
It was.
brutal.
I'll have to show you later, man. It was.
pull it up.
It was brutal, dude. It was like one of those where you go for a kick. They go to
Right.
do a low kick. What do you do? Kick him on the
He
shin or something?
supposedly checked the kick.
He checked the kick, and then, his leg or the femur, is that what it's called?
Well, the
No.
tibia and the fibula, the lower extremity bones.
Yeah.
Thank you. I was about to say I don't want to sound like an asshole. You're getting it wrong.
One of the
right
ones in the
front of him. The lower leg, the shin,
The hip.
snapped, and then he went to go step back on that leg, and it's already broken and flopping.
Oh, I saw this.
Yeah, it's
I
rough.
saw this.
And that's what
Yeah.
made it the worst thing. He took a step after.
Oh, it's the worst.
Yeah.
Oh
so
my
like,
God.
so like Silva, when he broke it, he went straight down. Whereas I think Wyman was probably didn't feel it yet, or maybe just in shock, and he went to take a step out of a reaction and just went down in general.
Well, there's so much adrenaline going.
Yeah,
that you don't
in
even.
general
A
with
lot of these
that.
guys probably don't even realize they're hurt
No,
until
yeah.
like a day after the fight.
Yeah. So go back. So I was in Florida. I started there for 2 years. We got pregnant with my first daughter, and Mona and I decided like maybe we should come back to Long Island because this is where our family was. Being around family is important to us. So we left and we came back here, and I hated physical therapy up here. I just hated it. I went through like 3 jobs in like 4 months. I just couldn't take it. It was traditional bullshit. Hot packs, no like engagement. Everyone was old. No offense to old people, but I went from working with such an athletic, driven population that was meeting my kind of expectancies with people what I wanted to work with, and I was like, I can't do this. I was gonna go back to Florida.
And now you're doing the usual. All right, take this and stretch.
Yeah.
It's
Right,
like, he's
yeah.
like, damn,
Right.
man.
It's just like everyone needs help, but it just wasn't my forte to kind of be involved in that population. So I said to my wife, like, I'm gonna go start my own business and see what happens. And I had a lot of friends on Long Island, and I joined the Best Gym, Bev's. I was kind of coming back and forth to Bev's because I grew up in the South Shore, and I opened up a business in Bethpage. And actually, Mona was my first like big cheerleading fan because Kevin English is the manager in the morning of Bev's. And I came back here in 2006, and Kevin had shoulder surgery.
Okay.
So he was sitting me on a counter in his arm in a sling, and Lou signed me up, and I knew Lou for a while. And then just kind of, I was always, I'm very quiet in the gym. So I just was, talking to Kevin a little bit here and there. What happened to your shoulder? I had surgery, simple procedure, arthroscopic cleaning up of the joint.
And that's when they just. That's when they just.
Yeah,
take
nothing
all
was.
the,
Yeah, like you
what
have
is it called?
calcification in the joint, changes the space mechanics, so he can't move correctly. So, but he was always kind of like moving his arm around, and it's like 4 weeks later, I see him, he can't lift his arm. So I was like, why don't you come see me? He's like, I got a guy. Okay, I don't want to, infringe on anybody. So here's my card. If you need anything, come in for free. And then Mona kept heckling him and being like, why you can't move your arm? And she's like, go see my husband. So finally, I was like, okay, I'll go call your husband. So I have no patience because I'm just sitting there trying to build a business. And Kevin eventually came into me, and I treated him one time, put his arm up. He grabbed all my cards, and then he went and talked to Steve. And I knew Steve a little bit from just being a kid coming to the gym when I was little. And then Steve came in. I treated Steve, I think it was for his elbow, because he boxes, he's intense.
Yeah.
And I treated his elbow, and he could move his elbow. And then he sent Bev, and then just started to go. with
Yeah,
all his
everyone
breath.
started trickling in.
Yeah, and then I tried to market to doctors, and doctors all have their own physical therapy practices, and they weren't sending me anybody. Just like they're kind of appeasing me, like, oh yeah, just leave your card and we'll send
Yeah,
some patients.
patting you on the back.
Yeah,
Just,
so
yeah, whatever.
Sure, why
just-
not?
So
they-
finally,
the tin is over there for all the cards.
exactly, and then
That's how
like
they act.
as you're walking out, another PT's walking with like, breakfast or lunch or something to give them food, and I'm like,
Yeah.
It's like copier salesmen, man. It's horrible.
yeah, and I'm not a kiss ass, and I can't. I'm not fake. I just here's my passion. That's what I love to do. Give me a shot. What do you have to lose? If I suck, then you learn that I suck. So I kind of said, what am I going to do? What can I do? So I started to go around, and I had some boxing background. I knew a lot of fighting gyms in the area. So I took my cards and I bypassed the doctors. So I went to each gym, baseball facilities, lacrosse camps, handed out my cards and talked to the coaches. I said, look, I'm new in the island. This is my background. Anyone gets hurt, or if you yourself has something bothering you, come see me for a free consultation, see what I'm about. If you like what I'm doing, send me somebody. And then slowly but surely, a lacrosse player would come in, a baseball player would come in, and then bodybuilders started to come in to see me. And then that was it. Just kind of you build your niche back to what I was going for and wanted for. And
Yeah,
I think,
you wanted the performance athletes.
yeah, exactly. And it just took time. And then people always make fun of me because, the most money is always in Medicare population, which is your geriatrics. And I'm like, well, that's great. I'm not about money. I just want to work with a population that's eager to get better and not sit in my office physical therapy practice and coming every week for the rest of their life. Come in when you need help and then leave when you're done. That's what I wanted.
He wants the people that are actually going to do the warm-ups when he tells them.
Yeah.
Right.
When he tells them, hey, this is what you got to do to prevent the injury going forward.
Yeah.
The people that don't do it are the ones he doesn't want.
Well, it's come in, fix the problem, and then leave. Then if something happens again, I'll be happy to see you.
Yeah, it's like I'm not that guy who's gonna say, "Come in," and you've been to me.
Yeah.
Don't come 3 times a week for 4 weeks. You know, are you in pain? No. Okay, so come in 2 weeks for a checkup.
Yeah.
You know, here's what you need to do. Like you said, do your working, your stretching, then come back and see me in 2 weeks.
I was such an ass, man. I went to him one morning. My back gave out or something,
remember
and he
that.
had just had the bicep.
Yeah, that's
Just
right.
had bicep surgery, and my dumb ass went to him in jeans when he had to stretch me out. I saw his face when I walked in. I went, "Yeah, probably should have worn something a little easier to move me around in."
Right, but like again, people don't realize that when you have your own business, the negative side is if I'm not working, I'm not getting paid.
Yeah.
So I remember Kai came back to see me, and I was only 3 weeks out of surgery, and I had my brace on. And he walks in, he's like, "Holy shit!" He's like, "What happened?" I was like, "I ruptured my arm." And he's like, "You give me all the work?" I'm like, "Yeah, don't worry about it."
Yeah,
You know,
I'll be
got
good.
it. Yeah,
It'll be all right.
yeah.
Yeah, he worked me out. He was great. I called him one time
that.
for one of my exes. My ex is at the gym. She hurt herself.
Right.
I'll tell. I with even how busy Mike is, I've never had somebody so respond like instantly. I texted him. I said, "Hey man, I don't know if you could do anything, or you could tell me, give me some ideas on what we can do."
Right.
But she hurt herself tonight. This is what hurts on her. He goes, "Come in tomorrow morning, 7 a.m." Wow.
Yeah, yeah.
Appreciate you. And
Yeah,
he's
yeah.
stacked schedule every single
Yeah,
day.
I do my best. All I ask people if they call or text me is like, if you're flexible times, I'll get you in. Just work with me.
And when you're hurting,
Right.
man,
Yeah.
you want me there at 4? When do you want me there?
Yeah.
Because I can't even sleep anyway.
Sleep
Right.
outside.
And then sometimes you feel bad because someone is so acute and you really can't do anything for them because you can't move them around because every position's like out. And I'm sure, Derlin said this as well. Like some people have like their back and twisted in place. And it's like, oh, I got to get you on a table, but now I could make things worse because I'll admit it because I really don't know what's going on because I can't assess you fully with an evaluation because you're so acute. So I have to kind of just go off what you tell me, the mechanism of injury, and go from there. But yeah, it's hard. Like sometimes if they're just too acute, you really can't help them, or you can
Yeah.
make it worse.
Yeah,
So
you
gotta
did.
watch that.
You did the dry needling for her that time,
Yeah,
which
yeah.
I've never seen. But that was the first time I had seen it.
Right.
Takes this
What is that?
The long ass needle.
It's
He
a
can
form.
explain it.
It's a form of acupuncture. The way I describe it is basically, well, we don't do it anymore because now New York State took away the rights to do it.
So it works.
But it works,
It
right?
works.
But we had some controversies with acupuncturists who actually there's always like lobbyists against what we could do, even though we have a doctorate degree and more training. No disrespect to the acupuncturists out there, but acupuncture is where you actually do meridians and you put the needle in superficially. So a dry needling is actually you pierce a muscle tissue, and the technical term is you're trying to reset a muscle spindle, which is one of the mechanoreceptors in your body that senses tension in your muscle tissue to either let go or create more of a contraction. So if someone comes in and you have a tight neck and you traps one of the culprit muscles involved, you can take a needle, hit the trap, floss it for a second, put a stim to it for about 10, 20 seconds and release it instantaneously.
It's wild.
So instead of me doing, soft tissue work or grassing, all these other techniques for,
Yeah.
half hour on you, I can change the mechanics in like 10 to 20 seconds.
It's crazy.
It's great. And patients who come in with migraines are the best ones who can actually appreciate this because you hit the suboccipital area and you can release their tension in a minute.
So that's what Derlin actually opens up on me. I usually go to him like every month and
awesome.
a half,
Yeah.
just because it's a quick ART. I was getting bad vertigo for a while.
Okay.
And I'll tell you what, it stopped, dude. Knock on wood, please, God, please. It stopped when I stopped caffeine in September.
Caffeine.
Dude,
Gotta go for it.
Yeah, I was getting it regularly, but it was kind of always the same chain of events. I was over caffeinated, I was overtired, stressed,
Yeah.
and my suboccipital
Suboccipital.
so tight you
Yeah.
couldn't even move them. Every single time I had vertigo, I'd go to him. He'd open those up, my suboccipitals, vertigo gone. I'd get off the table, no
Crazy.
dizziness.
That tension through the back of your skull, what it can do to you. Like in
It's insane. And
Yeah.
he said, you don't understand how common this is. How many people, because you're looking like this for the
front of a
phones.
computer all day long.
And that's what I do. I mean, I got
Yeah.
my 2 screens over there. I got this screen. I'm looking at my phone. I'm
Yeah.
looking at this little screen right here.
Yeah, yeah.
And I'm always squinting because I don't have my glasses on most of the time. And it's just, it winds up making you tense up and look and this and that. And by the time a month comes by, my neck is tight.
Yeah, yeah.
And I sleep like an idiot in bed too. I sleep like all crooked. I'm
Yeah.
the only one sleeping in the bed. So
Yeah, I
it's-
bought what is it, $150 pillow because my neck was bothering me one time, and I'm like, I get this pillow in the mail, and I'm like, really?
It wasn't good.
It was okay. I don't mention the brand, but it's just like $150 for a freaking pillow.
That's
but,
crazy.
But like when you're desperate for getting relief of your own kind of symptoms and pain,
Yeah.
you try to do anything in the world to make it much more comfortable, and sleeping is imperative.
Oh my
And that's
God.
when you recover.
Best thing I ever bought for sleeping.
Oh, he's like the go-to plug for this company.
What is it?
They need to send me a free one or a salary or something. It's called a bed jet.
The bed jet?
A bed jet. So
Okay.
I'm a really, really hot sleeper.
Okay.
Basically, it's the. You're laughing at me. This is the best thing I've
He
ever
loves
bought.
this thing
I
every
fucking
time
love
it
this
comes
thing. It's like an air conditioner and like a heater for your bed.
Okay.
So essentially, there's whatever you have the mattress itself, right? it sort of clips on top of the sheet, but under the comforter.
Okay.
So it's going to blow either hot air or cold air, whatever you want, under there. So it's not the comforter pushing on you all night for like keeping all the heat in. This full constant airflow, but you still have the sheet itself pressed against you because the air is pushing it down.
Right.
So when you put the cold on, you're not sweating anymore.
Okay.
And if you just want to relax, you put the heat on. It's fucking great.
So to go off of that, I agree with you. Definitely now for myself, because I was having trouble sleeping at night. So I was doing some reading, and obviously a cold room is usually a better room to sleep in.
Yeah.
So now I have ceiling fan going. I have my windows open, which Mona hates because it's freezing. But to attest to what you're talking about, definitely temperature is imperative to sleep good at night. So I was like, okay, so now I'm cold, but I'm definitely sleeping better than ever.
Yeah.
So it's
Bed jet, send the bed jet.
Yeah, bed jet, send the bed jet and the check to all of us.
I gotta check that out now.
Oh, that's it.
There you go.
just got another one potentially. Listen, we can't keep pushing these bed jets and not get a little something, a little residge.
But it's right, when you're cool at night, you actually sleep better. Like
I do sleep better.
I kick the
Yeah.
covers off me, and the ceiling fan blowing on me. I'm trying to relax, and
Then your back still's hot.
yeah,
There you go.
exactly. Yeah, and I'm hairy, so like you gotta just you take care of that.
Yeah, I you know what, I agree. I sleeping wise, I'm kind of so inconsistent. I got the Whoop band for a little while.
Okay.
And actually, it was giving me, dude, look, it was giving me dry skin underneath. Because like you're not supposed to take it off, you're supposed to charge it on and this and
Yeah.
that. So I give me like dry skin. I don't know. I haven't been wearing it. I haven't been wearing anything. I feel free. But that was one thing that I wanted to improve upon because I feel so tired. Now that I'm not on caffeine too. So like I wake up in the morning, I'm good. No, I don't need anything. Even
So
if I
no
go
more coffee whatsoever.
nothing. No pre-workout. No coffee.
Yeah, give you credit.
No teas.
I'm a coffee guy.
I don't
Just
drink tea.
Yeah,
Just whiskey.
Yeah, just whiskey. Just whiskey. We got more over there too. But by the time like the afternoon, especially if I have shoots all day or I'm editing, by the time the afternoon comes and I go to the gym at 7:00 now, 6:37 at night, I start getting that.
It drag.
There, you start dragging a little bit, and then if I fall asleep, then I'm up until 2 a.m. So if
Okay.
I fall asleep even for 20 minutes, I'm up till 2 a.m.
Just messes with the pattern.
Oh my God! Even melatonin doesn't help because I
Okay.
wake up at like 3, 4. I'll sleep for 4 or 5 hours, and then all of a sudden the melatonin almost like wears off.
What about CBD? You tried anything like that?
I've tried it. It doesn't.
Didn't do anything for you?
I actually tried. You know what CBN?
No.
So CBN is THC that they age in the sun,
Okay.
and it creates CBN, which actually is like a tranquilizer almost.
Is there any like
sedative effect? That's what it really
Okay.
is. And it's some companies, Bloom Farms, send the check. Bloom Farms makes a CBD plus CBN for nighttime use.
Okay.
So that was actually knocking me out pretty good.
I like CBD. I use it.
Do you?
I take
Yeah.
a little sublingual, and seems to, whether it's placebo or not, takes the edge off of me.
Yeah.
And I use that with sleepy time tea.
Yes. You know what? That's
That's good.
Sleepy
So-
time tea is great.
Yeah,
I have
so-
used that in the past
yeah.
too. Yeah.
So I enjoy that.
That must be pretty cool though that you have you have a really well-rounded knowledge about everything because everything kind of affects the athletic performance
Yeah.
in its own way. The nutrition aspect, the sleeping aspect, the actual training, the injury prevention and rehabbing.
Right.
I mean, obviously they all create one, I guess, harmonious person
Okay,
in
yeah.
general. But like, what do you think do you think they're all equally important or do you think there's one that kind of trumps the others?
I don't know. Good question. I mean, maintaining homeostasis in the body is key. But I don't pretend like if someone comes to me and asks me about nutrition, I actually refer out to someone that I trust for nutrition. So I have basic nutrition background, like you said.
Yeah.
But I don't pretend to be like, oh, I'm a guru with nutrition. This is what we're going to do for, monitoring your carbs, your protein. I don't do that. So if someone really needs specific advice, I'll recommend like my friend Tony or Chris Argiri, guys who have actual degrees in the field, and go forward from there. But everything works together, like you just said. You need good nutrition for healing. You need hydration. You need proper rest and recovery. So sleep is imperative for hormone production. And then obviously the proper strength training program to make sure your muscles are functioning well with the nervous system. So is there one thing more important than the other? For me, I don't think so. I think everything is equal because if you could be training like really well, and if you're lacking in sleep and nutrition, what happens to your training eventually? Goes
Plummets.
down,
Hold on.
tanks, right? So same thing if you're not eating well, you get fat, you don't work well with poor nutrition, or you're taking a lot of sugar in your body, and it's not going to work well for developing muscle. So everything together is important for my sake, in my belief. So
So now I have a question for you. In terms of injuries that you see, especially in the bodybuilding world, because we're an all-around podcast. I have a lot of entrepreneurs that listen, obviously,
Right.
but we have a lot of bodybuilders that listen as well. What do you kind of see most in your office? I guess is there a certain type of injury? Is there a couple that you can list, and maybe a couple of ways that you recommend
in the beginning,
That prevent?
right, everyone was coming to me like, for active release, like Derlin, I was doing that. The grassing techniques was, I've been doing it for 20 years, cupping. So it was getting like, for me, a little annoying because I'm not a massage therapist, no disrespect, but I'm a clinician and I want to fix people. So if you're coming in just for tightness, don't come to me for that. So now I've obviously established myself with like ruptures. So a lot of massive muscle repairs. So someone like that pec repair, that guy just tore working with Larry Wheels. You see the video of that?
Yeah.
So I've treated probably at least 1,000 pec tears in my career. And I
That was
love
rough.
them.
That was rough to
Definitely
watch.
one of the worst ones I've seen. And I was like, wow. Because not only did it just retract, it actually pulled all the way down like a lampshade across his body.
Yeah.
And actually, the first one I actually ever got that I thought was pretty severe. I mean, I've treated like pretty bad ones, but Scott Mendelson, Sean and Mendelson's brother. Actually, his year, I think it was like 10-year anniversary came back. You saw the picture of him. So Scott Mendelson is a world powerlifter.
Look it up.
So I was in California, and I was friends with Shauna, still am, and she sends me this picture of her brother, and she's like, Mike, my brother just ruptured his pec. Can you check him out? And I'm like, well, I'm in California, and I'm looking at the picture, and I was like, well, where's the injury? Because usually you see like a little bit of bruising down the arm and a little bit of a divot through the pec area. And if you look at the picture, bring up Scott Mendelson pec there, it was like black and blue down through his belly to his legs. And I thought it was
I've seen this. I've seen this
I
picture.
thought it was
That's right.
I thought it was a tattoo.
Yeah, I've seen that.
Yeah, so I thought that was a tattoo when I first looked quickly, and I was like, wait a second. And Sean was like, Mike, that's the blood and the pooling of the swelling. And I was like, holy crap.
God.
So I looked at it again, I was like, holy shit. And then, so that to me was one of the worst ones I've seen in my career. And then I saw the video of what's his name who just tore? Was it Scott something? Another Scott?
The guy with Larry Wheels?
Ryan something?
I
was
don't
it?
know his full name.
No
Yeah.
idea.
So I saw that video. Everyone was sending it to me. And I was like, holy crap. This definitely probably takes a cake that I've seen the worst one. And so like a lot of rupture repairs. So pec repairs, quad tears. We took care of Dave Palumbo when he ruptured his quad. He came
that's
to see
right,
me.
yeah.
And then, tricep repair. I see a ton of those. So really any type of like major rupture, I love rehabbing. It's a big challenge. And spinal replacements too. Like
And
some
kind
of
of what are like a couple like the intro, because obviously we don't know that side of what you do. So
So-
like what do you do to just kind of start getting yourself back to normal?
initiation of contraction and range of motion. So they're usually in a sling. So he's in a sling like this with his arm protected, not able to move it because you don't want the sutures to come out or the attachment to kind of come out of the bone. So you come in there. You saw obviously passive range of motion with him.
And I don't mean to
No.
cut you off. So what they do is they reattach. They go in surgically
Yeah.
and
So
reattach.
for him, it looks like in the video like he pulled probably the tendon through off the bone, so rupture there. So you have two ways you can rupture. You can pull the tendon off of the humerus and it retracts down like a lampshade, or you can actually tendon stay attached. And then you can rupture the tissue like this, which is not very good because you have nothing to like resuture. It's like sewing chop meat. So if you strain your pec muscle or you tear it to a better degree, it ruptures like that, and then you can't sew it. It's done.
It's like on a steak and trying to sew it in
Yeah.
half.
So like for me here, if like my right bicep is torn, and I was throwing an uppercut, so you can see versus the difference.
Was that what you were doing? You were throwing. You were boxing.
Well, this one I was deadlifting and it ruptured. So this one's reattached, no problems, knock wood. But you can see the contour between my arms is this one's fully down, nice contour. And this one through here, now the lateral part distally of my bicep is pulled up. So it's torn, but they can't do anything because my tendon is still attached if you see through
Yeah.
there. So there's my
Right.
tendon pulling down. So I'm aware now when I train arms because it feels different. So this muscle now is torn through here. There's nothing they can do about it. So the same thing occurs like through your pec. If you rupture fibers of the pec and the tendon's still attached, you're basically screwed. I mean, they can do like, injections, things like that. There's some 60-40% of kind of recovery if you do some type of like stem cell treatments, things like that. But otherwise, it's really just, it's torn and you're going to have to live with a divot.
Ooh, is that
I've
what it does? It just divots in.
Yeah, you just have a gap. So like Tony Freeman was the famous
Yep.
pro bodybuilder. If you looked at it, I think it was his right pec. He had, nothing there. It was just, but he was successful in competing,
Oh, it's gotta be. That's
rough.
wild.
Yeah.
And the deadlift one, that it just.
Yeah,
Were you
so
doing
I-
over under? Were you doing double
Yeah, I
over?
do
Yeah.
over and under. I used to compete in powerlifting, and I was getting ready because I was like, I'm gonna try another meet, and I pulled 525, and then no problem. So I said, all right. My goal was, as I was preparing my numbers to get ready for like a 12-week cycle, I was like, all right, I'm gonna try to get to 565, and then I was gonna shoot for about 590 on a competition weighing 181. So I lifted the bar, no problem, and I locked it out, but my finger slipped off.
Oh,
And instead of
Oh.
dropping the bar, I tried to grab the bar quickly again, and as I grabbed it, pop.
it just
Yeah.
pulled you. Just
Pulled
gave
all the
you
weight
the
up
right
there.
pull
Yeah,
down.
it just rolled right up. And I looked down and I was like, shit. And
That's shit.
yeah, I was like,
I need my next
it was
head.
like, right, it was like, damn it. My buddy caught it on video. He was like, did you just tear your bicep? And I was like, yep. And
Now, what do you do after that? Like, what?
I sat down for a moment and I was like, and I wasn't pissed that I got torn. I just was worried about working. Because like I said, if I don't work, I don't make money. So
I feel that if I don't shoot a video, I don't edit, I don't make
so,
money.
you know, people look at you like, oh, you're successful, you have a great thing, but meanwhile, like you said, you constantly got to work, and the downside is when something happens and you can't work.
Yeah.
So I was like, what am I going to do? And I was just kind of thought for a second. Thank God I met a lot of good doctors. I called up a few people, and right away they were nice. They were like, just come right over, let's check it out. And I knew I needed surgery, and there was a time frame, usually of about 2 weeks to get surgery. And I said,
Because
okay.
they want to attach it really quickly.
Yeah, because it can scar down, they say, supposedly. I mean, I don't know what the truth is with that, but, you know, they did the surgery, and it was not with no problems. I had good rehab. You can't even see the scar.
Yeah, no, that one actually was
looks
really
good.
good.
Yeah, so I worked it myself, but still, if I fully like supinate, it still doesn't feel the same as my right side. And I try to do a lot of, you know, stretching and things. It's 2015 when this happened, so 6 years later, some things are off.
Yeah.
But it is what it is.
That's how it is with my back. I have L5, S1 herniations.
Okay.
I feel it.
Yeah.
Like every now and then, it's, you know, a couple weeks ago, I was in a car accident a couple weeks ago.
Okay.
And the guy slammed on his brakes in front of me. And to try to avoid him, I went around him, and then he decided to turn back into my lane. So the front right of my car clipped the back left of his. And I'll tell you, as my adrenaline started to wear off a little bit, because I was super pissed.
Yeah.
As my adrenaline started to wear off, that 2009 injury when I was in a bad car accident, a guy hit me doing 70 from the side.
Right.
And T-boned me. And that's where I got the L5 S1s from.
Yep.
All of a sudden, I got
Woke
one
up
little
and there it
fender
is.
bender, and there it was.
yeah.
And then not even a week later, I couldn't even move out of my bed. And it's crazy because, like, you know it's there. Sometimes I squat, I feel amazing. Other days, you just feel it. You get
lets
that
you
little
know.
pinch.
Yeah.
Yeah, and I used to get, I mean, at 20 years old, 21 years old, I used to get horrific sciatica pain from that.
Okay, so now hopefully you're doing what you need to do to hopefully, like,
I'll
keep
tell you,
strong
you
and
know,
mobile.
you know what I mean. Hopefully you agree, but the doctor down in Florida that I'm very good friends with, sumo deadlifts. He had me doing a ton of sumo deadlifts, increased all my strength down there.
Yeah.
Sciatica pain gone.
Yeah, people have this misconception about, okay, if you have herniations in the back, you can't squat or you can't deadlift. Maybe I wouldn't be going for a barbell back squat with that compression on my back, but you know, deadlifting or front squats, it always comes down to technique, making sure your technique is sound and lifting correctly. But there's really no such thing as bad exercise. It's really what you can do and where do you want to go with that exercise, putting any more force across your lower back and things like that. Do you need to do it? No.
Yeah, I know it's tough because I want to squat, and it's not. I was definitely better at it years ago because
Right.
I was squatting all the time, and now kind of.
So in
I'm
that
kind of back. I'm kind of getting back to squatting again.
Right, but if you're not a powerlifter or someone who needs to be competing like a barbell back squat, why do you need to go there? So this is one of the conversations I have with athletes all the time.
That was always my
ego
theory.
of just
Yeah.
needing to squat.
But why?
I
So
know.
like, you know, athletes come in and be like, you know, I really want to get back to, like, I'm not gonna say Amit. So Justin's guy, I love Amit. I treat him all the time.
Yeah.
But he was so, you know, angry that I would not give him permission to back squat. And it's like you have herniations blown out in your cervical spine and your lower back, and you still want to load the posterior chain. Like, why? You're a bodybuilder. You just need something to stimulate your
Go on the hex
quads.
squat.
Right, exactly.
Pendulum.
Dude, goblets, front squats.
I see you.
Smith
You know, I
machine.
see you do goblets all the time.
Yeah, I love them. But so I practically preach. But there's a million, especially at Bev's gym. I mean, come on, there's so many machines in there to develop your legs.
Yeah.
I mean, obviously, functional carryover is imperative. Like we want to be able to, you know, do walking lunges, things like that. But you have to ask yourself again: is the risk worth the reward? Do you need to do that movement? If you're a powerlifter, yes, you need to be under the barbell and back squatting. If your career is in that point where you need to keep doing it, otherwise, no.
Yeah, I'm an out of shape bodybuilder, so that chances are no.
Right, but your goal should be now to be in shape, be strong, and be healthy.
Yeah.
Right?
Which I'm getting there. Yeah.
Yeah,
I'm getting there.
So why risk going heavy anymore, or really?
Yeah,
going
no, I
to-
don't. I definitely don't push it. I'll tell
Right.
you what, though. I felt when quarantine happened and I put the whole gym together in my garage.
Yeah.
I felt super good squatting in my garage though because I squat. For the most part, I take my shoes off. When
Okay,
I
good.
deadlift, when I squat,
Me too.
I take my shoes off. I just feel more comfortable, more planted. I actually got that from Evan Centopani when I was
Yeah.
up in Connecticut
Of
at
course,
Montanari.
Yeah.
And I was actually loading. We wound up hitting 315, 330 in my garage, 3-4 reps, pretty clean. Like not really feeling anything in the back. Just mostly just that. Oh shit! I got to get up kind of
Yeah,
feeling.
right.
So I felt really good, especially with the good bars. I had the calibrated plates in the garage, this
Yeah.
and that. But it's like, yeah, I don't load it up. I really don't load it up anymore. It's just not my.
It's not
For,
needed.
it's not. Yeah, it's not my forecast.
Yeah, right.
I just don't want to, because if I pinch my back that one time, because that's all it takes for me, and then I'm out 4 days.
Right.
I'm out 4 days, laying there, uncomfortable. I'm laying on my side and putting my left leg over my right leg,
Yeah, trying to stretch out.
trying to
Anything.
take the pressure off of my back.
Yeah.
It's tough, man.
Right.
It probably felt so good because you stopped squatting for a couple months.
That's probably why.
That's exactly why it felt good.
Right.
You
How
stopped doing it.
many people say that? Like, I haven't, squatted in a month. And then the question, like you said, is like, how do you feel? I feel good.
Yeah.
Okay.
Great, stop.
Right. Exactly. This hurts, doc, when I do it, so don't do it.
Yeah.
That typical
Well, how many
response.
people got, started feeling better from lagging injuries for years when quarantine, they weren't able to train for a couple months?
I think there's a mixture between that because I think if you don't do anything as well, you also lose that
Regress.
stimulation. Yeah, so I think you have to find that balance, especially as we're getting older or you have injuries that are kind of always going to come out and do certain things. But basically, if you can maintain a certain frequency in the gym, but not too much, you find that happy medium where you can train, but not aggravate the issue that's causing the pain.
Yeah.
So
Doc, 30 this year. 30, man.
I'm going to be 48, so I got you.
I'm going to keep my mouth shut.
20?
20-something,
But
16.
it's hard as you get older. Like, I remember coming back here. I started when 27 years old, and here we are now. And it's like, training hard, train with Kevin English, and, always pushing heavy weights, lifting hard. And now it's like, I grab certain weights and I'm like, shit, like, I can't believe I'm doing such light weight now. But like things change.
But you're still stimulating the muscle just as
Right.
efficiently.
I really maintain proper contraction. And I had a great mentor when I first started bodybuilding when I was 16, 17 years old. I mean, it was great. I'm blessed every day to meeting Andy. But that's who taught me how to properly train the right way. And I took that now and I showing people like Sadiq or Kevin English or those are the methods how you train, not just pushing weight, but feeling the muscle under tension, contracting.
Well, that's why I like the Dorian's method, which is all time to tension, real heavy weight, stretch,
Yeah.
squeeze, contract, and that's it.
Exactly.
There's no explosive anything crazy. Take your rest, make every set count, and that's it.
Yeah, I mean, even
Get out of the gym in an hour.
exactly. Need the drop sets. You use high intense methods to build muscle tissue. Like you said, in and out. Like how many people you see in the gym? If I'm in there, I turn my phone on and I'm like, here we go, timer. I'm just and people try to come over and talk to you, and I'm like, you have a minute.
I love it. He's
like,
great.
It's like really, and I'm like, yeah, like
50 seconds now.
Yeah, right. It's like I want to take a minute between my sets and I move along.
Yeah.
I got all day to be in the gym.
Every time I see him, because I see he's working like a horse, I just go, "Sup, Doc?"
Yeah, and even
Bye.
like
that's it.
we were training like Sadiq and doing all his videos, and it's like the camera guy's like, "Oh, what are you on your phone between sets?" And I'm like, turn it around. I'm like, "No, I'm timing his rest." And he's like, "Holy shit, really that intense?" I'm like, "Yeah." He gets a minute and 10 seconds between sets, and then we move. And they're like, "Wow." So.
Yeah, man. Well, actually, as a camera guy, and you can, jump in right after. As a camera guy, I can appreciate that because I don't want to be there all fucking day.
Right, yeah.
I want to get in and out. I don't want it to be taking 10-minute breaks.
Nah, it's
Unless you
like-
train biceps the day before, you don't hold the camera up.
Oh God. No, Dell's
Then you're like,
shoulders.
take your rest.
Shoulders was the worst for a while, man. When I was first start filming and I wasn't used to holding the camera.
Cameras are
that
so
long.
good right now, though, right?
Yeah, well, it's heavy. It's a little chunky when I load it up. It should go on a diet.
Hold a 5-pound dumbbell for an hour.
Yeah, man.
I don't want
it. When I have the stabilizer,
Yeah.
when I used to use the stabilizer for almost all my shoots, I would be holding it like this, 10 minutes, 15 minutes, or somebody you're doing the talking head, which is somebody just standing there, if you're looking at the camera, we're working this because of this and blah, blah, blah. You start looking at the timer, 5 minutes, 10 minutes. You're like, oh my God, he's still talking. It's
no.
oh God. I'm like, I should have brought my tripod for this.
Yeah, and I think that was really cool. Like, obviously all the camera people out there we worked with were always like, Camp, you're always so like precise. We love it. And I'm like, well, I've experienced with this, and I appreciate your time. So I know you really don't want to be here more than you have to be, like you guys have said. You just want to get the information. And then people who are listening, they want the information. They don't want to sit there and listen to like you go on and on and on and babble. You're like, okay, what do I need to do? What is this guy doing for the set? What kind of exercises? What kind of rep scheme? And you give the information, you move on.
Yeah.
So I want to go into, before we get a little bit more off topic, is muscle adaptation to getting stronger versus tendon adaptation.
Okay.
Like how, let's say the guy who was doing the incline bench, right? His pecs might have been able to handle it, but the tendon wasn't strong enough.
Okay, so you're going down a road that maybe talks about pharmaceuticals, right? So if we start there, so we talk about like,
Oh God.
so if you're training naturally your
Yes.
whole life, right? So what happens to the tendon adaptation as we increase force and tension over that tendon over the years? It gets more tensile strength. So if you take someone now who's using maybe an anabolic and they go from, say, benching, let's use as an example, 200 pounds, they put on 30 pounds of body weight, now they're benching 315 over a course of, say, 6 months. Is the tendon adaptation there, or is it just muscle tissue that adapted?
Right, it's just the muscle.
More muscle tissue, and the tendon couldn't adapt over the time. So now what happens is you have obviously a higher chance of injury. So a tendon tears or ruptures off. So that's what happens. So natural athletes over the time, constantly lifting a certain way over years and years and years. Tendon pulls on the bone increases tensile strength of the tendon adapts, muscle tissue adapts as well, increased force production, able to handle that increased force production, stronger. and it doesn't have that hopefully profound effect of tearing when you go to try to max out at a 1 rep max.
Certainly a lot safer.
Do you?
Yeah.
You really you see that? You see a lot less. Of
Yeah, I
those
think
tendon injuries
if
and
you
ripping
read
injuries
things
on
in the
natural.
journals, yeah, definitely. I mean, you see it in the gym, like guys all the time, they'll go on, unfortunately, anabolics, and they put on a massive amount of weight gain, massive amount of strength. Their egos pumping, and they go good. So I can bench 315 now when I was just stuck at 225, and they do it. Unfortunately, they haven't adapted over the time course to allow their muscles and tendons to accommodate the force, and they rupture. Yeah, pretty much. I see. Was it proven in research? No, because you can't do research on people who don't do drugs. So there we go. Right? Because I mean,
I like how we
anabolics-
find that funny.
Yeah.
That's funny.
It's the truth. People,
Yeah.
prescription drugs now is like testosterone works, but we can't look at research on it because it's taboo. But we can give oxycodone and say,
Wild.
Of course.
it's crazy. So there's a lot of misconceptions in the world.
See, now that's the first human study I'll sign up for.
I would too, definitely, because how many guys we know in the gym that are on hormone replacement therapy and they're in their
course.
40s and they're like, wow, I just feel like I was in a fog from 40 years old to 50, and now I feel good again.
Yeah, I've
So
heard
they're
a lot
not-
of people say that. It
They're
feels
not
like a fountain of
abusing
youth.
it. Yeah, they're not
Yeah.
abusing it. They're doing a prescribed dose of it. They need to be done. They do their blood work. They're getting checked. No problems, knock wood. Unless you have an underlying condition, there's always an example for something. But for the most part, everyone that you talk to is doing great. You know?
Well, that's one of the biggest misconceptions is take medicine, let's say 30 years ago to where it is today.
Right.
When they said, let's say the healthy testosterone levels for a 50-year-old man, right?
But how do
They're
you know?
not healthy testosterone levels to live with.
Right.
So that's just the average 50-year-old man's testosterone levels saying, well, it should be around, I don't know, let's say 200.
Yeah.
Something like that, right? And you're at
Which is still pretty
one-
low, right?
very
Yeah,
low,
big time,
very
very
low.
low, yeah.
But they're saying, well, normal 50-year-old guys have that, so you stay there. But it, as you know, it's raising your risk of cancer, raising risks of everything.
Heart
all
disease, everything. Yeah.
everything.
Yeah.
But with hormone replacement therapy, where everything medicine is nowadays, you're able to live a healthier life because medicine went that far.
Yeah.
It's not saying it's the healthy levels to live with. No, these are the healthy levels. These are the levels because you're a 50-year-old man, so let's help you get there.
And then, John, to build off of that, they're comparing it to an active 50-year-old man or a sedentary 50-year-old man.
Exactly.
So a man sitting on his couch, most likely. Like you go for physical now, thank God I have a good sports medicine doctor. But like in the past, when I would be getting my liver enzymes checked, they're like, "Oh, you're a little bit elevated." And I'm like, "I just trained. What do you expect them to be?"
Yeah.
Or they're still comparing. My daughter goes for a physical, and you're still using body mass index as a marker. Are you freaking kidding me?
crazy.
She's lean.
Yeah,
It's
I've
crazy.
been obese for years.
Me
man.
too.
And it's like, get off. You should use body fat analysis. Get something in there to assess body fat analysis. Like
Use your eyeballs.
right.
She's fine.
Exactly, right? Just look at the athlete coming in there. My daughter's very lean. She's 16, but
I
it's
just
like,
did a video for Get Tanked, Long Island.
Okay, yeah.
They tanked them, they
Yeah,
dumped
yeah,
them,
yeah,
get
of
the whole
course,
BMI
right,
and everything.
yeah.
I did some stuff for Dexafit a couple months back.
Right.
So yeah.
but it's
do-
pathetic.
Do real
These
studies.
are medical professionals that supposedly half the public will look up to, but they don't have the common sense to say, like you say, look at you and say, wow, you're in shape, but your body mass index is high, so you're fat.
Sir, I believe you're obese. Where?
Yeah, right, exactly.
Yeah, I'm
Where?
pretty sure I saw John's
shit.
Instagram post the other
So-
day, and he had leg veins running through there.
So again, you follow the science, and science can be always talked about and deciphered a little bit more in depth.
Yeah.
Yes.
So
Science can be played. The numbers can be played with however they see
everything,
fit.
every journal's all the time, and actually, if you look at the studies and like, okay, this one is kind of biased. Maybe who's sponsoring the study to be done, who's the subject matter, what's their background. So you really got to look at the research really in details. So,
Instead of just seeing something and going, okay,
like how many people you see on Instagram now? They'll take a research study and say, "Oh, you can't do X, Y, Z before you train," or something like that. And it's like, well, who is the people they're looking at?
yeah.
You know, like one of the misconceptions was that I do is you don't do cardio prior to weights. Well, why not? Because you're taking away, and it's been looked at, it's been proven to be not effective to do cardio prior to weights. But what if I do cardio, then supplement like maybe with some type of carbohydrate drink after to restore my glycogen levels, and then I do my weights? Is that okay?
Yeah.
Sure.
I mean,
Sure,
Should be.
theoretically, yeah.
Theoretically, I'm replenishing my glycogen stores, so now I'm back to hopefully a good state. And I've been doing this now for 5 years. I do cardio first because I can't. I go to the gym early in the morning, so I'm tired. I need to wake up, so I do cardio first. But I take a carbohydrate drink afterwards to make sure I hit the weight strong, and I feel not good, always good. Doesn't affect my strength.
How long is the uptake?
I
you
use
start feeling-
what do you call it? The NutriBio, the carb one.
Carbolin.
Yeah, Carbolin.
Yeah,
so
that stuff's good.
Thing's pretty quick.
Everyone likes NutriBio stuff.
But I'm
heard that's
I'm
pretty
strong here. Like mentally, like I don't really look for kicks. I'm a coffee guy, unfortunately. But
I love coffee. I do, so
yeah,
it's-
me too. Like I just dropped it on the way in here. I was like, fuck, But I don't, like I said. There's always these research studies that you read that will maybe show one thing, but we always have people that can live outside the research and say, no, that's not true. It works for me.
Well, every research study has the biased opinion of whatever that person happens to be doing.
Yeah.
Everybody says you don't need carbs. Carbs are the worst in the world for you. have a cookie before I go to the gym every day.
Right.
I use the sugar, and it's a bad fucking habit. If I ended up going to Starbucks to get coffee, I'll always get a cookie. I'll eat a cookie on the way to the gym, and then I go work out.
I've seen people do the Rice Krispie one.
Same exact thing. Just getting sugar. Just getting sugar.
I did the If It Fits Your Macros for a little while back when I was doing like really If It Fits Your Macros, so
Yeah.
Pop-Tarts before the gym.
Yeah, I'm a macro guy, and then like
within reason.
anyone in the gym, we're all a little bit mental. So whether it's from like whatever athlete you were kind of doing, like I was wrestling, so I always had a body image thing. But like everyone says my carbs are way too low, and I'm like maybe I am because near the end of the day I become dumb. Like in the morning, I take all my carbs in, my brain's good, I can talk, I can feel very, like I'm flowing very nicely. And then come around like 6 o'clock at night, I'm like, man, really, what's going on? I feel like
A little fog.
A little fog.
Yeah.
So maybe I do need more carbs, but me, every time I eat a carb, I'm like, shit, I went from 8% body fat to 10% now. And it's tough.
That's me too.
Mentally, I admit it. Like there's something obviously mentally wrong with me for that perspective. Like I got to eat more, but I just don't want to.
Yeah.
So.
Well, every bodybuilder in the gym has body dysmorphia and an eating disorder.
Yeah. Totally agree.
Hands down.
Totally agree.
We all started somewhere with we were too heavy, too skinny.
From a different disorder.
Yeah, it's you always have that. You always have that issue where you just don't feel like you've been good enough, and then I'll tell you what really screwed it up for me. What really screwed it up for me was competing. I wish I never competed.
Really?
Honestly, I think it was good to do. I think I think it pushed me to do something that I had never had done before, and it made me strong. In terms of resilience and staying on a plan and
Right.
staying consistent and accountable to myself and my coach at the time. But I mean, ever since I stepped on stage, body's never good enough. Ever.
Really?
I didn't even go to the beach. I was lean. I was shredded. I don't even know why I didn't go to the beach.
You did it for yourself though.
I was
That's the
lean
key.
though. I should have been out. I was on college at that time. I was shredded. I should have been on campus naked the entire
Right,
time.
right,
I don't know
right.
what. I still. Look, I gained a little bit of weight after. Well, I gained a lot of bit of weight after the show. The first show was horrible. I went up 35 pounds in 3 days. The second show, I stayed very lean and I looked good.
Right,
but
right.
it's like, in my mind, it's like, oh, holding a little bit of water. Nah, I can't take my shirt off.
And it's tough because you're in an environment where you're surrounded by a lot of anabolics. So like I was a natural bodybuilder my entire life until like the last part I want to try an NPC show because I was doing well in the INBF and I had some words with the owner and he would never give me my pro card. No matter how many times I took second place, he just wouldn't give me and I was always shredded, great conditioning, phenomenal. And finally, I said, screw this, I'm gonna try an NPC show. So I was like, I'm gonna try a little bit of anabolics, but it was for myself. I wasn't looking to become like a pro or anything. I just wanted to always compete for me. And but like you're always chasing that guy in the gym who's bigger and he can diet down and be lean and maintain muscle mass. Whereas when you're clean and you diet down, you just become like a lean, ripped dude. Like you lose your muscle, you lose your strength, and you get shit. I just like went from benching 275 down to 205. Like what's going on? No matter how much you try to hold on to that strength, it's hard.
Yeah.
Because you're not on the anabolic. So that's the problem. I think is you're surrounded, and a lot of people don't talk about it. Where I was enlightened at the age of 16, where the owner of the Mr. America gym came to me and said, "You're never gonna look like me because I use drugs." And I was like, "What? What the hell are you talking about?" He's like, "We use steroids." And I was like, "Really?" And he's like, "Well,
It's eye-opening for a lot of people. They
big
don't
time."
really
It was
understand
definitely
that.
crushing because you're a big fan of Muscle and Fitness. You're reading all the articles and you're looking at like guys like Lee Haney and Lee Labrada, and you're like, "Wow, I want to look like this." And these guys are 5'7", they're 190 pounds, but I'm 106 pounds, but I don't look like that. And I'm pretty lean, but it's like, and then finally you get educated on the real deal. And then, like I said, Andy was phenomenal. Just said, "Look, I'll take you under my wing, teach you how to train, teach you how to eat. And then when you're ready to compete at the next level, but you're going to college, you want to do sports, you're not going to need it. But eventually, if you want to go to the next level, you will need to use it." But that was the best conversation I ever had because from that point on, I was like, well, I can train for myself a little bit right now, and then I'll cross that bridge when I need to when I get there. And
That's what makes me nervous when I see a lot of the younger guys at our gym.
it's starting too young.
Oh my, way too young.
Yeah.
I mean, I haven't even taken tests. I haven't taken anything.
God
So,
bless you, you're young. Why would you? Hormones are
yeah,
still
I'm going to
good.
be 30 this year. I said to myself, I was never going to use them to compete. So for me, it's like I'll just keep natural.
And I don't have a problem if people do it.
I don't
It's
either. I don't
fine.
care.
Of course.
I don't care.
Yeah.
But be smart.
Yeah,
Be smart.
that's
Be smart
about it.
Yeah.
Just do your research. No,
And
don't just believe somebody that's telling you, like a guy who never went to school for science and
Yeah.
biochem. Don't let him tell you what drugs to take. Because
Even doctors can't tell you the side effects when you're combining, like, say, a testosterone derivative versus a growth hormone and things like that. You start combining all these other things and orals and like, so a guy's just telling you to take things off the street and like he has no background telling, like you said, how to take things combined. You don't know the effects of these medicines together.
yeah, I have a friend that
Real
go,
quick,
go.
half of them aren't even real medicines. Half the names are like little puns because somebody thought it was funny. You know, like if you're buying a bottle of test
True.
from somebody on the street, it's just some like a big boy test, whatever. I'm making up names.
Right.
Let me.
Let's laugh.
I got big boy test 250. Let me shoot it in my shoulder. Why is it green? I don't know.
Right.
Hulk
Or-
serum.
Right. So like it's just unfortunate. Like you have these people come to your office. Unfortunately, they've had a cyst mark or an abscess, and they want you to work on it. Like, dude, that's infected. I can't touch that.
You're gonna get it drained.
Yeah, exactly.
Then you're liable if you touch that.
yeah, big time. You can spread an infection to the rest of the body. So it's like, not
I have
really.
I have a friend who started taking growth
Yeah.
for no reason. Doesn't train like he trains at the gym with me like every now and then, but it's like it's not like he's going crazy. He's
No.
not. She's like, yeah, it's healthy to take it. I'm just like, is it though? I don't really know. Like, who are you hearing that from? Like, what forum did you read that on?
The guy who sold it to me.
Yeah, like,
He said it was good for me.
You need a year supply of this.
yeah. You need this every month.
That'll be
It's like,
$3,000.
But again, hopefully, like you educate the people. Like for myself, like when I tore this, I took some Morlin, which is a natural precursor for a peptide for stimulating your own growth hormone. So I was contemplating doing growth, but everything I read was like, okay, maybe if I have a cancer cell in me, and if I stimulate that cancer cell, then I have a problem, or maybe something else that's going on.
Is that what happens with growth?
Supposedly, again, there's no research that can prove that, but growth hormone affects what? Every tissue in your body.
Yeah.
It's not like testosterone. Testosterone affects your muscle tissue.
And that's scary enough hearing that. That's scary enough for me never to touch it.
Right. So I was like, you know what? I'm not going to do growth, but I did some work and research on some peptides, and I realized Cimarolin was a great derivative. So I called my doctor and says, "Can you prescribe me this, Cimarolin?" He's like, "Yeah, no problem. I'll prescribe it for you." So he did. It was expensive, but I definitely feel it was imperative in my recovery, and I did it. I did
Nice.
it for about 6 months, and then I said, "I'm done with it." But in return, like I remember going for a haircut, and my barber was like, "You doing anything? Because your hair is so like soft and like everything looks good." And I was like, well, I'm taking this peptide for a growth hormone precursor. He's like, wow, so it looks good. And you feel good. So like you said, back to anti-aging, it's important to kind of investigate these areas and look into it, not just for feeling good, but also physical well-being.
It's amazing how much funding out there is for bullshit ass research
beyond.
studies, but not for real studies like that, where they're different items that could help make men feel younger or live longer and perform better.
Right, exactly.
Well, that's like medical marijuana, for example. That was pushed into the corner for so many years. Now they're like, hey, by the way, this really, really helps cancer.
And that's because they can make money off it now. That's what they waited
Exactly.
Oh, big time. But why'd they wait so long? Because New York State's in bankruptcy, and then they need like funds that are like obsolete here. So we need a way to make more money. So we make approval of medical marijuana.
Well, as soon as Jersey did, they're like, all right, you guys are going to drive across the Briggs, or we're going to make the money.
It's always a scam somewhere
Yeah.
going on.
It's exhausting.
Yeah.
It's exhausting.
Yeah.
So, I mean, now I want to kind of just touch on, I've seen you at the gym working with a lot of different athletes. You work with Sadiq.
Yeah.
You definitely helped change his physique.
Thank you.
Because that was a big transition for him, going from men's physique to classic.
Right.
And I think that's when he kind of started just working with you.
No, I was with Sadiq he came to me in 2013 when he first actually was getting involved in physique division. So we worked from then. And then I was just getting too busy. So I don't have much time. So I was like, I can help you when I can. But he was looking for someone more full time. And then he got back to me in, I forget what year it was, maybe 2000, geez, what the hell we at, 21? So like maybe 2016, 17. So we just wanted to put more muscle on. He's young. And then he wanted to go to Classic. And we really didn't feel Classic was the right for him because those guys are big.
Yeah.
No matter
big
how,
and my size, shorter,
so
tight,
stock grade. So I think he last show we worked together was he went back to physique. And he did good. But again, you have all these other coaches involved, and I respect everyone, but we have too many chefs in the kitchen, and that's the problem. So it was like, I think I worked very well with Sadiq. He always trusts me. Same thing with Kevin English, always trusted me, and we did great. But when you got getting people involved to kind of voice their opinion and try
whispering in their ears.
Yeah, it's like, it's annoying because it's like I don't always agree with things, and I won't voice my opinion because I don't want to be that guy who's trying to talk down about anyone or say this is what we need to do. You have to make up your own mind, ask questions, ask a lot of questions, and then go from there and make your decision what seems appropriate for you to do. So I think Sadiq is a good spot now. I think he's starting to prep now again.
I think so, yeah. I haven't seen him because I go so late. I don't really see him.
So he looks good, and we go from there. But Sadiq was he's a great athlete, trains hard, never questioned what we need to do, always pushed, gave me 100%, and he watches form. Like he listens to everything still to this day how I taught him. So I look at him in the gym and I'm like, this is great. So he doesn't try to do anything different. He still maintains proper form. He contracts everything. Now he trains people. He always gives me credit. So he's a class act. I love Sadiq. Yeah. So.
Yeah, he was supposed to. He wanted to come on a couple times, and the schedule just didn't match up. And
Yeah,
we were going to try to get him in for the 50th episode, and then we kind of just got backtracked. So we'll definitely have him on at some point. But I know that's, I see you working with him all the time, and
and he's misunderstood too. A lot of people think sometimes he's very quiet, and you don't know his background like I do. If you talk to him, he'll tell you about his story when he was upbringing, and so.
And not for nothing, he's at work. When he's in the gym, he's at work.
Right, and I've seen him take time when after I've crushed him on legs where he's on the floor ready to puke, and a fan will come over one time. I remember this, and he's like, Sadiq, and like, can I get a picture with you? And he was like, just give me 1 minute, But he did it, and I was like, people don't see that side of him. He was always very like gracious to people, took time, shook their hands, just said, let me finish my workout. If you're still here, I'll come take a picture with you.
Yeah.
And just like you said, let me do my job.
It's nothing but a nice guy.
Right, exactly.
Just like it's your job when you're out there training.
Yeah,
Yeah.
right.
So I wanted to touch on your academics, you teaching. So
Okay.
you obviously have taught classes over the years. What were those classes based around? Was it at Hofstra? Where was it at?
Yeah, so I first started teaching at LIU in Brooklyn. I went into the graduate program for exercise science. And again, it was tough because I always feel like I'm not ready to be giving knowledge or taking students on. I don't ever feel like I'm ready or good enough yet. And like even being on a show talking to you about myself, it's hard. But so
You're doing great, by the way.
All right, thanks.
Yeah.
So
It's a good dry run. We'll turn the mics on in a half hour.
So I go to LIU. They're like, we need you to teach a neuroscience class. I was like, wow. And then I was teaching a functional movement screening class and another NASM class. So 3 classes I started with. And I love neuroscience because it's underappreciated and there's so much involved that we don't understand. And we have PTs out there talking about reflex mechanisms and we can change a movement. And they think it's going to hold. And it really pisses me off. So yeah, I started teaching neuroscience. And then after a year, I was doing very well. I had an idea for creating a course encompassing kind of what my philosophy is in PT, rehabilitation and transitioning to the strength and conditioning world. So I developed a program for that. The course was successful. And then I guest lectured a few times at Hofstra, and they had a position for me to teach anatomy physiology. So I was like, drive to Brooklyn or drive to Hofstra.
Oh, damn. Such
So-
a choice.
Yeah, such a choice because your commute on the BQE is horrendous.
Yeah.
So I came to Hofstra in 2018. I started teaching anatomy physiology, and it was only one class, but I love anatomy physiology. And my chair at LIU was afraid. He was like, "Oh, I don't want to lose you," but like I said, the commute is killing me. Treating patients, I still have to have my practice. I'd run my practice, and it was just an easy thing. So
And once again, if you're not there working, you're not making money. So you got to be there.
So you got to balance your time. So saving an extra 3 hours a week of my commute time can treat 8 more patients. So it was good. So I love being at Hofstra. So I teach anatomy physiology, and it's been really tough right now because of COVID with everyone's being on Zoom, and especially anatomy physiology. You need to be there.
Yeah.
I mean, these are people who are trying to become doctors, PAs, nurses, PTs, and you have structures that you need to pick up in your hands and move around and manipulate to prepare for your professional phase, get ready for cadaver dissections, and they're on a screen, and now I can't test them except using a picture.
Oh.
So teaching is very, I love it because you give back and they exchange ideas with students as well. Like you always learn from everyone. But like I said, it's just become frustrating. So supposedly the fall semester, we're
It's
going
going to
back.
be in person.
Yeah, but now someone told me that they're going to mandate making sure that even professors are getting the vaccine. So
We shall see.
we shall see. So
Yeah.
we
It's
gotta
all
see.
it's all speculation until it actually happens.
Yeah. So, that's been teaching with that. I love that. And then we branched out into creating seminars. So we've been doing some seminars too. And then before COVID, they were going very well. And then again, COVID comes along and they squash.
Yeah.
So
Which they'll ramp back up.
yeah, just finding time to do things again and travel and get people to come in. It's a building process.
Yeah.
So
Yeah, because I guess not everyone's like us. We just feel comfortable right at the gate.
yeah, I'm with you. Yeah.
We're just ready to
good.
go.
Right, yeah.
Yeah, we're ready to go at all times.
Same way. Yeah.
Somebody thinks they'll be the next cadaver.
Jesus. Yeah, I mean, listen, I think the accolades speak for themselves. You're an awesome individual, human, teacher, and trainer and coach. So I think I want to end on one more thing. I want to end on if there's people that are in their starting positions, like when you were first starting out, what kind of advice would you give them if they want to get into specialty fields like you're dealing with or other specialty fields? Is there like some piece of advice that you'd give them, some route, something like that?
Yeah, I think always is best to always reach out to people that you want to look up to and you ask them for a mentorship. So that's what I did. I seeked individuals who I admired, who had a similar training philosophy that I looked to improve upon, spend time with them, ask questions, read as much as you can, and build your own thoughts when you take these ideas from people, but question. Like not everything is the gold standard. So it's like if someone says this, it doesn't mean it holds actually what you need to be talking about, but you take the concepts and you kind of just build off of that and say, I agree, but I don't really agree, but I'll use some principles of that approach. But talking to individuals who have done what you want to do and then seeing if you can go beyond them. So I teach students now, I always say, if you're kind of doing the same thing I'm doing, you suck. You should be better than me. So I'm at 47 years old now. So you should be there now when you're 35. You know, that's what I would be saying to people. Like, you know, push yourself. And it takes time. And the money, you can't do something for money. Like, especially PT. Everyone's like, oh, you know, I want to make all this money. And, you know, money comes with time. There's no shortcuts. As we see people on social media, you know, we're all trying to post for accreditation and build a following.
Yeah.
You know, I didn't go into this field for money because it's not very good. I mean, I'm doing well now, but it's because I didn't push for money. I pushed because of my passion for treating athletes and wanting to help the best and not to become recognized as one of the best. Because if someone's out there in the ring or throwing a baseball in the field and they have proper mechanics and they have a successful game, I can look back and say, I helped that guy. Whether he gives me acknowledgement or not, I just have pride in my work.
And that must be a feeling right there.
It's a great feeling, always. No matter what you're working with a gymnast who's 12 years old or an athlete who's coming back from a massive repair, like, say, Weidman, someone like that. So you're always installing your knowledge, and so you have to seek that, and then you want to make sure that you push yourself to become even better than the person who's teaching you. So
I wanted to ask was, because that just reminded me, is there anybody you fixed, not necessarily name-wise, but situation-wise, that really sticks out to you to this day?
There's actually a few, but who can I go with? There's been so many, but for an age-wise, you know, Ellen from the gym. What's Ellen's last name? Ellen and Greg.
Yes.
Yeah, of course.
Oh, yeah, she listens to the show all the time. She's
Right,
great.
so I'll give her a shout-out. So Ellen's daughter, Celeste, is a phenomenal gymnast. And, you know, like, she was suffering for a year with different injuries, and she came in, and I just kind of gave her a different look. And then she competed, I think, a month ago, and she did great. And it was like, you get a text, I get emotional, but it was like, you help someone, you know, it's like kind of cool.
Yeah.
So it was actually really, you know, a girl who was like, you know, has future aspirations to maybe become an Olympian or go on to college and be a D1 athlete. It was like, you know, I helped this girl. So it was kind of cool, you know. So like throwing that, or Chris Algieri, you know, coming through so many injuries, and a guy who's been, you know, coming from kickboxing, and they said they couldn't become a world champion. And he became a world champion with a broken orbital bone and other injuries.
Wow.
And he did it through a good team, whether he gave me credit or not. But as part of that team, I'm not looking for credit, but like the fact that
You know you were there in the dungeon
You're
in
the
the
pit crew.
hours.
You're the pit crew.
Right, exactly. And you don't want credit. Like, I'm not the guy who's looking for it. You can look at someone in the ring or doing their event and be like, they had success because I hopefully had a little bit part of that. So that's my take.
Saving lives and changing lives.
Yeah, right. Great point.
I love that. Well, I want to thank you for coming on.
I appreciate
You're an
it.
Absolutely,
outstanding
Mike.
guest.
Thanks.
Obviously, like I said earlier, we don't invite people on that we wouldn't want to have back on, and that extension goes to you as well. We'd love to have you back on anytime you want.
100%.
You know,
Thank
if you
you,
start,
Nick. Thank you, John.
If you
course.
want, if you have another course that you start to, you know, work on at Hofstra, or you make more programs, stuff like that, and you want to come on talk about them, anytime you want.
appreciate
We're
that.
always here for you. So,
Thank you.
on that note, I'm gonna have John kick this outro.
So I'd like to thank everybody tuning in this week's episode of The Voice.
And Rizzles, joined by none other than.
Doc Camp.
Let's go, baby.
All right,
Peace.
Thanks, guys.